Jala Neti is one of the 6 purification procedures or Shatkarmas mentioned in Hatha Yoga Pradeepika. Jala Neti is a technique that was used by yogis to stay disease free and most importantly to use the breath well for their yogic practices without any blockages. Just how brushing the teeth is dental hygiene, the practice of Jala Neti is nasal hygiene. This technique uses water to purify and clean the nasal path right from the nostrils to the throat. The things required for Jala Neti are a neti pot, lukewarm water and preferably rock salt. The temperature and the salinity of the lukewarm water should match the salinity and temperature of the tears. The first step is to check the patency of airway in each nostril. The nostril having better patency should be selected for the procedure. Patency can be checked by placing a finger below the nostril to check for the airflow. Another way to check the patency is to close each nostril and inhale and exhale through the other nostril. The nostril with which you are able to breathe better is the nostril of choice to start the procedure. Fill the neti pot completely with lukewarm water. Bend lightly from the hips and take shoulder distance between the feet. The patent nostril should be at a higher level and the neck should be slightly bent on the other side. Gently place the nozzle of the neti pot into the patent nostril. The elbow of the hand which holds the neti pot should be at a higher level. The water will start flowing from the patent nostril to the other nostril. Do not inhale or exhale through the nose during the entire process. Breathing can be done through the mouth. Repeat through the other nostril. Precautions to be taken while doing the neti process. Breathing should be done only through the mouth till we finish the entire process of Jala Neti. Fix your gaze towards the sky and head bent upwards during the entire process. If we constantly change the head position, the water gets obstructed in the respiratory pathway and we get a choking or coughing sensation. It is a misconception that the water can be directed towards the brain if our head position is incorrect. There are no openings between the nasal pathway and the head. The temperature and the salinity of the lukewarm water used should be similar to the tears in our eyes. Neti should not be practiced if we have excessive cough and cold, nasal congestion or ear infections. It is absolutely mandatory to dry the nose completely after practicing Neti. Otherwise, there are chances of catching cold in the process. Procedure to remove water from the nostrils post Jala Neti. Keep shoulder distance between both the feet. Slightly bend from the waist and leave the neck and head loose. Raise the neck up and then leave it loose such that the head touches the chin. Repeat it 2 or 3 times. Tadasana. Stand with both feet touching each other. Stretch the hands upwards with the fingers interlaced. Inhale as you raise the heels and forcefully exhale out as you strike the heels against the ground while bringing the hands close to the head. Repeat it 2 or 3 times. Sit in Malasana. Wrap the knees with your hands and pull it close to the stomach. Exhale while touching the right ear to the right knee. Repeat the same process on the left side. Repeat it 2 or 3 times. Bhastrika. Close the left nostril while you rapidly inhale and exhale through the right nostril. Repeat the same procedure through the other side. Continue with each nostril for 8 to 10 times and continue the process till your nose is completely dry. Kapalabhati. After finishing the entire process of Jala Neti, Kapalbhati should be practiced for some time to ensure that the entire nasal pathway is completely dry and free from obstruction. It's best to learn Jala Neti under an expert or a guru. We hope this video will be useful for you all to practice Jalaneti regularly. If you like this video, do like, subscribe and share. Thank you.